We are looking at several areas for pharmacists to expand their practice. That is something that we have talked about with the pharmacists groups. We have had those discussions within the Ministry of Health, and now the issue has to go back to the colleges for that discussion. So it would really be premature for me to say at this point exactly what's going to be included, because of course the colleges have to be in favor of it. And they will also require perhaps additional training for pharmacists if they choose to enter into those additional scopes of practice. So I'd like to tell you exactly what it will be, but that's going to be up to discussion with the colleges. And in terms of the time frame, it does take a long period of time, sometimes up to a year, for this to happen. We are hopeful that we can work with the colleges to move that forward, because we know that we need those supports. People need services and they need them in their own communities. The most important thing here is convenience to the patients and making sure that patients can get the services that they need in a timely manner. Sometimes people aren't able to get in to see their physician, for example, during the course of the day, but they can go in on weekends, they can go in evenings to see the pharmacist. If it's a low-grade issue, then we believe that there are certain things that pharmacists should be able to treat. But that will be up to further discussion with the colleges and working within their timeframes, but we hope that we can move a little bit faster with some of it.
Are you sensing any pushback from OMA or doctors on this? Are they playing along with this, or are you going to have to do some fancy footwork negotiating this with them as well?
No, I think all healthcare professionals recognize that in order to integrate care and center care around patients, it's going to be important for everyone to work together. That's the whole purpose behind Bill 74, and we have found health professionals to be very amenable to working together, and the integrated care is already happening in many communities that I've visited, where you have primary care, pharmacists, home care, long-term care, nurse practitioners, all working together because they recognize the primary goal is to make sure that the patient is supported throughout their healthcare journey.